We now have the much anticipated quiz round for all fellows and DM students. All faculties are also invited to engage in this quiz. To all the participants, remember this is your chance to thrive, shine, and to learn and enjoy. I will now request to call the quiz coordinators for this segment, Dr. Rachna Shanbag ma'am, pediatric rheumatologist at Apollo Hospital and Jupiter Hospital, Mumbai, and Dr. Jigna Bhatia ma'am, pediatric rheumatologist at ICU.
Hello and good morning to everyone. I hope all the fellows and DM students are in the hall. We'll be starting the quiz shortly. So the quiz will be conducted on the Mentimeter app. So all you need is your smartphone. You can scan the QR code and we can begin with the quiz. So there are few basic rules about the quiz. The faster you answer, the better you get the points. And we have a total of 20 questions. So I hope all the students who want to attempt the quiz are in the hall.
Also, the quiz is open for all. Only the fellows and DM students, we request you to type your name so that for you all there's a prize, the one who wins, and otherwise it's open for all. And you really don't need an app, just scan it and the website will open on the phone. Prize is only for the students. No chocolate.
Khajas for faculty.
Ma'am, I was thinking of doing that during the gala dinner, that we'll start the quiz at night and give out chocolates.
So faculty members are welcome to join. We have Jagannath Puri Prasad as gift for all the faculty.
The name of the Wi-Fi is Conference 5G. It's an open Wi-Fi, so you all can join through that. Scan हो रहा है क्या? They will.
So to join, you have to lift your smartphone and scan the QR code on the screen. Once you do that, on your website, either Safari or Chrome, the app opens and you will be able to put in your name to join the quiz. So we'll be beginning with the questions. I hope all of you have logged into the app.
PGs and the fellows are requested to type in your name so for the calculations. Rest can.
So I think we have 34 players who have joined in. I'm sure many of you can. We'll just wait for 2 minutes for the others to join.
The code, she wants this code.
So let us begin. Okay. Okay, so we have around 44 players right now. Okay, so the first question will flash on your mobile screens. Which of the following variable is not a part of CJADA scoring for disease assessment in JIA? The options are physician's global assessment of disease activity, parent-patient global assessment of disease activity, CRP ESR, active joint count. So you will be able to select the option on your mobile screens, and once you do that, you move on to the next question. Last 5 seconds. Okay, so we have the right answer here is CRP and ESR. CJADAs is the clinical JADAs, which excludes in which CRP and ESR is not a part of the scoring. So I think we have 15 candidates who answered the right option. So moving on to the second question. Which of the following is false regarding Childhood Myositis Assessment Scale or CMAS? The options are: CMAS evaluates muscle function and endurance. A score of less than 10 is considered as severe disease. It is not regarded as the best measure of muscle strength. And combination of MMT and CMAS is known as hybrid MC. So the correct answer here is the second option. A score of less than 15 is considered as severe disease for CMAS. Moving on. Question number 3, 4-year-old boy who's 20 kilos in weight, having oligoarticular GIA, presents with persistent right knee swelling. He needs an intra-articular dose of steroid. Which formulation and dose is preferred in this case? Okay, so the correct answer here is the second option. Yes, I agree. So bonus points for everybody here. Which of the following biological DMARD neutralizes the activity of both soluble and transmembrane forms of TNF-alpha? Options are etanercept, infliximab, adalimumab or belimumab. So the correct answer here is infliximab. Name the RCT which studied the efficacy of adalimumab in treatment of children with JIA associated with uveitis who failed topical steroids and methotrexate. Options are Juve-Bright, Adjuvite, Sycamore and Adjust. So the correct answer here is Adjuvite. This was an RCT carried out for adalimumab in treatment of JIA associated uveitis. So KidCare trial, a multi-center comparative effectiveness trial assessed which of the following treatment options in Kawasaki disease? IVIG versus steroids, IVIG plus cyclosporin, infliximab versus second dose IVIG, and steroids versus infliximab. So the correct answer here is infliximab versus the second dose of IVIG. Which of the following changes are not seen in active scleroderma pattern on NFC? And the options are capillary loss, capillary hemorrhages, ramified capillaries and avascular areas. So I think most of you got it right. The answer here is avascular areas, which is more seen in the chronic form of scleroderma. Okay, so we have the leaderboard here. So I think Dr. Paromita is leading here. I don't know who has named it as doctors. One of you, maybe. Okay, so this is an interesting one. Identify the image. And the options are MONA, CACP, PPRD, and PVNS. So I think the crowd has answered it right. The answer here is CACP, that is Camptodactyly and Coxa vera. Okay, so this is an interesting one for everybody in the audience. The first step is to identify the actress and which autoimmune disease does she have. I think Suma ma'am is going to get it right. So the options are lupus, myositis, MCTD, and Sjogren syndrome. I'm sure you've heard of U Anta Wawa. She's Samantha Prabhu. Okay, so I think most of you know she does have inflammatory myositis. Okay, so this is a tough one. Match the pathogen associated molecular pattern and the respective pattern recognition receptors. So the correct answer here is LPS for TLR4, dsDNA for TLR3, single-stranded RNA for TLR7 and 8, and zymosan for dectin-1.
Okay. So we've reached halfway through the quiz. I wanted to tell this in the beginning, but I'll tell this now maybe. Being the youngest most and the newest most members of the society, if there are any mistakes, we are here to learn also. Yeah. The most important investigation for therapeutic monitoring in FMF, which also assists in titrating colchicine, serum amyloid A, CRP, ESR, interleukin 1. The correct answer is SAA. Which of the following is false regarding SGIA-ILD? Septal thickening was noted in HRCT. The biopsy findings were similar to that of pulmonary alveolar proteinosis. Elevated interleukin 1 is seen in patients with SGIA-ILD, and patients with SGIA-ILD have recurrent mass. Which is the false one? I think this was discussed yesterday. It's correct. Interleukin 18 is actually increased because of the increased use of interleukin 1 and interleukin 6 blockers, which tilts the pathways more towards interleukin 18. A patient with chronic non-infectious uveitis has failed topical steroids, methotrexate, adalimumab. What will be the next preferred drug? Infliximab, etanercept, cyclosporin, anti-IL-1. It's correct. The fourth line is another anti-TNF alpha, infliximab. So these are the pictures of a boy who had come with us around a year, 1 year, 2 months old boy who had come with us with a sudden history of swelling of lower limbs and a rash which had developed like this over the last 5 days and pain abdomen for the last 7 days. The blood pressures were normal. So which condition is it? The options are PAN, APS, DADA2, acute infantile hemorrhagic edema of infancy. Correct. In acute infantile hemorrhagic edema of infancy, it is not PAN because the BP was normal and it's very 5 to 7 days, very short duration history.
So this is a young boy who has presented with recurrent fevers, rashes, Raynaud's with elevated ESR and CRP on multiple occasions. So which systemic autoinflammatory disorder is this? FMF, SAVI, Candle-Pras or AGS? This is a classical textbook picture and yes, the answer is SAVI.
This is a famous actor, Morgan Freeman. What does he suffer from? SLE, fibromyalgia, Sjogren, RA.
Let us have a vote from the audience.
It's very surprising an actor of this caliber actually suffers from fibromyalgia.
So most of you thought it's Sjogren's, but it's actually fibromyalgia.
A very dedicated person is very... Yeah, even Venus Williams suffers from Zika syndrome. So 8 years old female suffers from low-grade fever for 3 months and has these characteristic rashes. She also had arthritis and weight loss. Which of the following is the least likely? IBD, DADA 2, sarcoidosis and tuberculosis. DADA 2, correct. It is erythema nodosum. Tofacitinib blocks which of the following? Jack 1, 2, 3, all. All. It is a non-selective JAK inhibitor. This is just a bonus question. Anybody can answer. Maybe we have the chocolate which Devashish has got. Which vasculitic skin condition is this? Rash का नाम नहीं है. It could be. This is a patient. Okay, I'll just tell because I haven't put up any. It's a bullous HSP actually. There was no case and we had to put a tiebreaker, so this is a bonus question. I think everybody deserves chocolates here. Sweet will have more of a erythema nodosum like rashes.
So, I think the winner here is someone who named it as doctors. Did somebody enter their name as doctors? If not in this case, then we'll have to go with the second one.
Ma'am, it's app-based, so...
Who is AP? Anushka? So, none of you are owning up to who is doctors? Because I think that person has got the maximum points. AI. Okay, in that case, I think Dr. Anushka wins the quiz.
But she's not a fellow or PT. Okay, next. Next, Deepu.
Okay, so Devashish promises that he'll give the prize to Dr. Anushka later. Thank you everyone for joining the quiz and apologies for the 3 questions. I am sure it is a learning experience for all of us. Second one. Transition, somebody has... Ma'am, why was it named transition?
Oh, she had the previous session, right? And third. देखी लो. Third. Oh,
He's a student. Third. Okay, so number 3 is Aroki Raj. I think he also deserves a round of applause. Thank you everyone.